If you're suffering with bladder or bowel problems and pelvic floor exercises aren't working, then this might be the video for you. What a lot of people don't realise is that fluid intake is one of the top causes for bladder and bowel issues. And actually, before I even ask you about pelvic floor exercises, I'll be asking about what you drink. You could even say that fluid intake is more important than pelvic floor exercises. Hi, I'm Isla and I'm a physio specialising in women's health. And in this video, I'm going to explain how hydration can help with symptoms of bladder leakage and urgency. A lot of women that I work with restrict their fluid intake as they're worried by drinking more will make them leak more or need the bathroom more. This is very common and only natural. We then have the other side of things where there are some ladies that increase and drink large volumes of fluid to make them feel fuller for longer to help with dieting, or they might be exercising more. However, both of these done over a long period of time can actually be detrimental to the bladder. Let me explain. I want you to think about your day and what you drink. Go through your daily routine and write it down. Write down what time it is you're having a drink and whether it's a tea, water, coffee, or a glass of wine or 3. And then write down the volume of what you're drinking, whether it be a glass, a cup, a litre. Maybe pause this video for a second, have a think and jot it down. The amount of fluid intake does differ slightly from person to person, depending on things such as weight, activity levels, and whether you're breastfeeding, but a rough guideline is around 2 litres of fluid a day. Another good way of knowing is if your wee is dark in colour or smells strong, then you need to be drinking more. Now, if you've written down your volumes and you can clearly see whether you're way under or way over, and that in itself tells you what changes that you need to make, that might be all that you need to know and go ahead and make those changes. However, if you want to understand a little bit more about why these changes are important and how to make those changes, then continue watching. It may surprise you that the bladder is a muscle, and just like any other muscle in the body, it can shorten and it can lengthen. I often use the analogy of a balloon filling. Not enough air and the balloon never stretches, and too much air and the balloon doesn't recoil as well. And then you have just the right amount in the middle. If we don't drink large enough volumes, then the bladder never stretches, therefore it can't hold as bigger volumes. Likewise, if we drink too much, the bladder overstretches, and that can also cause problems as well. If you need to increase your fluid volumes, then it's really important that you do it gradually, just like stretching any other muscle in the body. What I generally recommend is increasing your fluid volumes between 50 to 100 mils of fluid, which is around about this amount, every few days or so. Otherwise, it could cause you discomfort. Likewise, if you're drinking really large volumes and as you start to reduce your fluid intake, you start to become thirsty or dehydrated, then it will be important that you go and see your GP. In my experience, making these changes to your fluid can have a dramatic change to your symptoms in just a week or 2, but you need to be consistent. To make these changes more effective, combine it with my other video on types of hydration. Do give us a follow and a subscribe for further tips and tricks on management of bladder and bowel problems.